Okay, this is our second video on treatment. Today we're going to talk about radiation therapy or radiotherapy. We're going to talk about how it works, how do they do it, what's it used for, and the side effects. So let's get into it. So radiation therapy, what it does is it kills cancer cells by slowing or stopping growth by damaging the DNA. If it can't grow, it can't live, and it starts killing the cells off. It's a cancer treatment, uses high doses of radiation to kill the cancer, basically, or shrink tumors. There are many types of radiation therapy, and they vary by application, dosage, type of radiation, and the method of deployment. And every one of them is tailored to your specific case. How does that fit with you and your case? But most can be broken down to the following, or variation of the following. So you have internal or brachytherapy. So what that is radioactive material is implanted inside the body. So dozens of tiny seeds that contain a radioactive iodine are placed at the tumor site. They usually use either a needle or a catheter, and the seeds are placed in and around the tumor site. And I've even heard of it placed inside the tumor, I think. So if somebody's ever had that, maybe you can let me know if they actually put it in the tumor itself. Brachytherapy is used for the treatment of prostate, cervical, endometrial, vaginal, and breast cancers. That's what they use. That's the internal stuff. So the other one is external, from a machine outside the body that delivers a beam via a linear accelerator, which is called an IMRT machine. So my radiation therapy was external via the IMRT machine, or the intensity modulated, I'm having to read this, intensity modulated radiation therapy. This was given to me 5 times a week for 7 weeks for a total of 35 treatments. How did we do that? Well, first of all, once everything's approved and you go into the, put you in the machine, they give you a scan. They want to see exactly where the tumor is, where everything's lined up. Then they prepare for what's called a thermoplastic mask. This fitting involves the mask being placed in hot water, in a hot water bath, until it's softened, and they place it over your face and mold it to your face. They clamp it down, they clamp it down to the treatment board, and they bring this thing, they bring it against your face, and they press it very tightly against your face like so, molding it as a mold to your face. What's the purpose of that thing? Well, that's to hold your face steady for the treatment so that your body is always in the exact same position, okay? So once they've done that, they then run a CT scan again. So the technicians get a baseline scan, I guess you call it, for the measurements, etc., in order to begin planning for treatment. In this picture, what you're seeing is one of the radiation technicians holding my mask, and you see the center line down the center of my face, which shows the center line of my body on the mask, my face and head. And then there's tape on the other side that also has 2 index marks as well, showing where the center of my neck is. And in this picture of the IMRT machine, the actual one I used, you can see the green lasers on the wall, which are used to line my face and body up to the IMRT machine so that the radiation dosage is in the exact right place. So at first the mask is a little tight and uncomfortable, but as treatments went on, I got used to it. And since I started losing weight, it wasn't so tight, a claustrophobic feeling. But a typical treatment would go like this. I would arrive at the cancer center, I go back in the treatment room and lay on the table. The mask is placed on my face and tightly locked into place on the treatment board, for lack of a better term. It's locked in. A scan's made to check the tumor and to map out the treatment regimen for this particular session. So once they've done that scan, then they actually start the treatment. The machine begins a circuit, and it'll go around your body 2 to 3 times to make sure it's putting the right amount of radiation in the exact spot. So as it's going around, you can look up, there's a big disc, and there's some metal fingers in there that are doing this number, kind of crossing, moving back and forth, in and out. And basically they are shaping the radiation beam to the shape and size of the tumor to minimize the amount of radiation in healthy tissue and maximize the radiation into the tumor itself. So as it goes across, if you're doing that, I encourage you to look up and watch. It's kind of cool to see that happening. How the machine knows that, I don't know, but it's pretty amazing stuff. So once it does its 2 to 3 times, it's finished, and get the announcement it's finished. They come in, lower the table, take your mask off, you're finished. 20 minutes after arriving, you're on your way home. So that's not so bad. You don't feel anything. There's no pain, no burning sensation, no really even strange noises. It's just the machine going around your head. So after that, though, what are the side effects that you can have? Around the 3rd week, I began to have trouble swallowing. It was painful. My throat became painful and constricted. By week 5, I was totally reliant on the stomach tube for nutrition and hydration. The skin on the left side of my neck was red and patchy, like a never-ending sunburn. I mean, it's not like the pink sunburn, but it would be red, dry, patchy, scaly. It changed color, not in a healthy way, but that's what it looked like. It was all right here. By week 5, I'd also lost enough weight that I had to have a second mask fitted. I started at 120 kilograms, which is about 260 pounds, went down to 90 kilograms. This is around week 5, to 198 pounds. So I'd lost about just over 60 pounds in 5 weeks. And my total weight loss due to my cancer treatment was down to 79 kilograms, 175 pounds. So quite a bit, almost 100 pounds of weight loss. Normally, I would be thrilled to lose that much weight. However, it's not a diet I'm going to recommend to anybody. So the other things I had was cotton mouth, which is a loss of taste, loosening of teeth on the treatment side, which I didn't expect at all. But I would bite down, I could feel the teeth moving a little bit in my mouth. That was weird. The other thing I had was a bad mucus buildup, or what they call mucositis. It was in the back of the throat. I also had pain, like a throbbing sore throat, that would increase and decrease without ever really going away. And the palliative care doctor gave me all sorts of great pain medications, but nothing really made it seem to go away. The good news to all this, it's all survivable. Almost all my taste buds have returned. I still have a little bit I still have the dry mouth, but nowhere near as bad as I did during the treatment and immediately following. The mucositis has gone away, and that's really it. I feel good. I feel healthy, and I've got my 1-year scan coming up here at the end of the month here in December, and looking forward to getting a good positive scan for that. And we'll talk to you next week. See ya.